Dr. Jeff talks love. Dr. Jeff talks life. Answers your questions, cuts through the strife. Sex and intimacy, real and true. Evidence-based, made just for you.
Hello and welcome to Dr. Jeff Talks About Sex and Intimacy, where we explore both the science and the soul of sexual wellness. I'm your host, Dr. Jeff Albaugh, and I'm so glad you're here. Today, you're joining us for episode 47, The Truth About STIs, Myths, Facts, and Safer Sex for a Healthy Love Life. So whether you're watching live or listening to the recording later, thank you. I truly appreciate every single one of you. Your engagement, your curiosity, and your willingness to learn are what this podcast is all about. So thank you so much. So we're connected across many platforms: Facebook, YouTube, X, LinkedIn, and Kick. So please join us. If you're joining us on X and you want to submit a question, don't forget that you can submit those questions. Hop over to YouTube, to LinkedIn, to Facebook, to StreamYard. Any of those will let you submit your questions. So also, if you are a Facebook person, a quick favor, please follow us on Facebook, because the more people who follow us on Facebook, the more we can do on Facebook. So please follow us on Facebook, and we look forward to seeing you there. All right, visit us on the website. We are on the website, and to learn more about upcoming episodes, and also you can pull up the 46 episodes that are there. You can pull up the calendar and look at what's coming up next, what's in the future. We have things all the way through February in there, and we have amazing guests and amazing people joining us. So go on the website and find out all about this podcast. Also, we're where you are, so you can take us with you. Dr. Jeff Talks About Sex and Intimacy will go wherever you are. Listen to us in the car, on your favorite music streaming source, whether that's Spotify, whether that's Amazon Music, iHeartRadio, and more. We're there with you when you're working out, when you're riding along, when you're on your road trip. If you're going on a road trip over the holidays, take us with you. I'd like to remind you that, as always, all are welcome here. Whatever your sexual orientation, your gender identity, or your relationship style, this space is designed and made for you, everyone. So you are so welcome here. The mission of the podcast is really easy. It's to empower and enlighten you with the information you need, the scientific evidence-based information to help you make informed choices so that you can improve your sexual health, deepen those loving relationships, allowing you to live your one miraculous life more fully and more wholeheartedly. Today, we are diving into a topic that so many people worry about, whisper about, or Google at 2 a.m. about, but they rarely get clear, compassionate information on sexually transmitted infections. So this is a really important one tonight. So whether you're partnered or you're dating or sexually active or simply curious, wanting to know the facts can transform fear into confidence. STIs are incredibly common, highly treatable, and absolutely manageable. And yet, the stigma around them can cause far more harm than the infections themselves. So today we're going to clear that fog a little. We're going to talk about prevention testing. We're going to talk about communication. We're going to talk about what real sexual wellness looks like. I couldn't think of a better person for this topic than someone who has dedicated her career to women's health, sexual health, and thoughtful evidence-based education. So Amy Hall is a nationally respected women's health nurse practitioner and sexual health expert at Vanderbilt University Medical Center. With over 2 decades of clinical experience, Amy has become a trusted voice in women's sexual wellness, STI prevention, and reproductive health. Now, Amy's clinical work centers on providing inclusive, shame free care for people of all ages and backgrounds. She's known for her ability to translate complex medical information into clear, compassionate guidance that meets people where they are, whether they're navigating STI diagnosis, exploring safer sex practices, or advocating for their own sexual well being. In addition to her clinical practice, Amy is a sought after educator, lecturer, and mentor. Most importantly, Dr. Amy Hall brings a grounded realism and a deep humanity to every conversation, reminding us that knowledge is power, prevention is love, and no one should ever feel alone in their sexual health journey. So, I am so excited to welcome my guest, Dr. Amy Hall. Hey, welcome, Amy. So glad you're here with us tonight.
Thank you, Jeff. I appreciate the introduction so much. It was so kind. Thank you.
Well, it's true. And you're a marvelous person too, and a good friend. But I'm really excited. Amy wrote the chapter in the core curriculum that I edited for urology nurses on this. She co-wrote it. And so I thought, gosh, who could be better to talk about this than you? So without further ado, I'm going to hand things over to you and have you give us this incredible presentation.
Thank you. Thank you for the time. And I so, like I said, so appreciate you thinking of me for this. The chapter that we worked on, you mentioned the core and the chapter on STIs that I and Dr. Megan Blair worked on. So have to give her a shout out as well. This was a fun opportunity that we had. So thank you very much, Jeff, for thinking of us. But without further ado, I'll dive right on in. I thought I'd sort of tailor this conversation today around really sort of parceling out a few myths. There's a lot of myths out there, unfortunately, and I think a lot of us hear things that maybe are true, maybe aren't true, but we don't really get good sound information from people like Jeff, who really know the literature, really know the evidence, and can really help guide us. And so I hope that I can impart a little bit of knowledge to everyone today, so that you can feel a little bit more empowered and less fearful, and hopefully more engaged and communicative with your partner or partners, so that you can have a much robust but also healthy love life. So without further ado, I'm going to go ahead and start off with our first myth, and let's see if I can get this to move. I'm not sure. Here we go. Have to figure out all the technical things. So first myth, I think a lot of us think, and we think to ourselves, and we may say, I always practice safe sex. I'm already doing that. What do I need to worry about? And the unfortunate fact is that there's a lot of things out there that we don't know about, and maybe we do need to be a little bit more educated on what it means to practice what we call safer sex, because there's really no such thing as absolute safe sex. I wish, it was, we never had to worry. But the reality is that we do. And so we have to really consider protection with all modes of sex, not just with, for example, vaginal and penile penetration, but all forms, whether it's oral, anal, everything. And I think we forget about that, or at least we as providers certainly forget to talk about that with our patients, to really give you the education that you need. So it is about all modes and being as safe as possible, understanding that there is no absolute 100% safe. Um, it's a little bit different for everybody, but for women, certainly that's the population that I primarily do see. And so for women, it's a little bit more unique. And the reasons why can be variable and pertain to different times in our lives. Certainly, there are benign changes that can occur on the cervix, which is the door to the uterus, so to speak. Um, that can make it a little bit easier for infections to potentially transmit, if you will. And so, unfortunately, it is a potential increased factor for risk. Pregnancy certainly introduces another unique issue with regard to not only the changes that the cervix goes through, but also changes in risks for the unborn fetus during the pregnancy. And certainly also when we talk about safer sex, we also have to think about safety for women who have sex with women, women who have sex with women, who also have sex with men, and really knowing our partner, really knowing what the risks are, because it's not all just we don't our lives aren't just completely and totally compartmentalized. And so we have to be very mindful that it's entirely possible that even if we are in a same-sex relationship, it doesn't necessarily mean that our current partner has always been in a same-sex relationship. And so that can potentially introduce risk that we may not have been aware of. We do know that over 50% of women do report having a prior male partner at some point in their lives, with as much as 25% having a prior male partner within the last 12 months. So that does introduce the opportunity to have that conversation so that we can really understand and practice again safer sex. We also have to consider men having sex with men are not necessarily same gender in same gender relationships at all times. We have to remember that there are opportunities for people to have other partners, and so we have to be very mindful that risk can potentiate, and those are things to consider when we're certainly considering what does it mean to have safer sexual relations. All right. So myth number 2, I only have one partner, so I can't get an STI. I can't tell you how many times I've had conversations with my patients, just the gut-wrenching conversations that we've had where it's like, where did this come from? I'm only with this one partner. I've only been with this one partner forever. How is this? And the unfortunate fact is that, we have to consider that not just because I may be in a solely one monogamous relationship, it doesn't mean that my partner has been with only me. In the past, there could have been potentially other partners, and we have to remember that it's not necessarily the same for everybody. And again, we have to consider all modes of sex. There is some belief that sex is only vaginal penetration. And so I have not had any other partners, for example, because I've never had vaginal penetration. There are people who do not think that other modes of intercourse qualify, but unfortunately, it does introduce again risk. And certainly, we won't get into the specifics of each infection. Probably the most common infections, I will just name a few, the most commonly diagnosed per year in the US include chlamydia, trichomonas, herpes, and human papillomavirus. Those are the most common, and we think as much as 65 million diagnosed curable cases of STIs occur per year in the US. And unfortunately, that's, now considered old data. That's a few years old. But as of 2022, it was about 65 million of diagnosed curable cases in the US. And we again also have to consider, even if people have just one partner that they've never had penetrative intercourse, that doesn't mean that they're not at risk. We can get skin-to-skin contact with some infections. And so I did find this little schematic here from healthysexuals.com, which I thought was very, very helpful to give us some information on, reminding us that not everything is the same, and there is different risk depending on, again, modes of intimacy. Myth 2A, I don't have penetrative sex, so I can't get an STI. Again, see the previous slide. That's all I think we need to say on that one. Sorry. Advance my slide here. Myth number 3. I get this. Less safer sex may mean less pleasurable sex. That's a huge, huge concern for a lot of people, and I get that. There are ways, opportunities to introduce greater pleasure with still safer intercourse. And so certainly there's opportunities to think about how you can eroticize the condom and make it funner, more pleasurable for you and your partner. And certainly when we're talking about condoms, we're not just talking about male condoms, but also female condoms. Thinking about outside the box, different ways to make that more fun and again, more pleasurable to improve the experience, while at the same time practicing a safer relationship. We definitely recommend using a good water-based lubricant. We do not advise the oil-based types that can potentially break down a latex condom. So we recommend a water-based lubricant. You could also, and that can help with greater pleasure with the friction that some people do experience with condom use. We also recommend trying flavor-based condoms. For example, when somebody is giving oral sex. Strawberry, vanilla, all kinds of different flavors that might make it a little bit more fun for everybody. Always, you want to make sure you're putting a condom on an erect penis. Certainly that can also introduce opportunities to make things more fun with tactile stimulation and then role play and things like that with putting on that condom. So lots of different things that can be done to make it more pleasurable. It doesn't have to be less pleasurable. We can expel that myth, I hope. Myth number 4, I'm not at risk. That's for the young people to worry about, not for me. I do have a fairly sizable population of women who are getting into their older ages and who are wanting to live robust and very, very social lives. And a lot of my patients, hopefully, we're all living longer, and we're living longer with more vitality and greater health. And that's certainly a focus, and certainly having healthy sexual relationships is part of that focus. But the sad reality is people divorce, people become widows and widowers, and we may, because we definitely want to have a more robust and vital lifestyle, certainly may have an opportunity to meet new partners, and it's a risk, unfortunately. And again, it's a more opportunity to educate us all, regardless of our age and where we are in our lives. So it's certainly important to make sure that we all remember, regardless of our age, where we are in life, we do have risk. It's not just for when we were in our teens and 20s. We do see that there's a greater focus again on men's and women's health and being more having that greater vitality. We're having more discussions on hormone replacement therapy, and the black box warning specifically for hormone replacement for women is if it hasn't been removed, it's about to be removed. And so that's also opening the door for women who certainly might want to start taking more hormone replacement. If that black box warning is gone, it takes away some fear, but also hormone replacement, it does help us to have changes, healthier changes to our genital tract that would make the opportunity to have intercourse certainly more pleasurable. So those are conversations that we need to have, that patients want to have with us, and it's certainly important. We have an increase in growth in retirement communities. So more older, retired aged adults living together. And again, unfortunately, life happens, and we may have divorce, and we may have death of a partner, and we may be in places where we can meet new people, but we can't just assume that we're, again, not at risk. So certainly important for us to keep those things in mind as we advance in life. Oops. And then myth number 5, it's okay, I can get treated and cured. Sure, there are some STIs that are curable, and with efficacious antibiotic therapy or antiviral medication, we can certainly have treatment of certain infections. Not every infection is curable. Certainly, our viruses, human papillomavirus, herpes simplex virus, can remain dormant and flare up, so to speak, even though we can take medication or have treatments for those issues. Our bacterial and our protozoan types of infections are curable, but it doesn't necessarily mean that we can take a medication and we can move on. There's no other concerns. Unfortunately, even our curable infections can have long-term, lifelong sequela or complications, if you will. There's risks with something called pelvic inflammatory disease, PID, and that's typically more common with chlamydia and gonorrhea, and those two infections can cause PID. We can treat PID, but issues with PID can persist throughout life through chronic pain, adhesions development that can increase the risk for pain, increase the risks for potentially for infertility, making it harder to achieve a pregnancy because of scarring. Certainly there's risks for increases of ectopic pregnancies getting stuck in a tube, again, because of scarring from some of these infections. Cancer is certainly a risk. We do know that human papillomavirus, HPV, the virus that causes warts, also increases the risks for cancer of the cervix. And so even though we can manage it, we can treat it, more than likely most people resolve, if you will, their HPV. It doesn't mean that there's no potential for a downstream effect. And there are hundreds of different mutations of some of these, specifically HPV viruses. We can see neurologic disease, bone disease, heart disease. We see that with syphilis, long-term syphilis. We can also see increased risk of more rapid heart disease development, cancers with HIV. That is a managed chronic condition now, but certainly we do have other things that can develop even though we are seeing much, much better management of a lot of these conditions. Certainly, we want to mention types of protection. We've got just a couple of pictures here. I'm not married to any brand in particular. I just wanted to make sure that you had a little bit of a different look of different types of products, whether it's the latex male condom, the latex female condom. You can also use natural-based types of condoms. It's important to remember, though, that they may not offer the same protection as your latex type, and so those are things to always consider. We've got dental dams here that are also flavored, as well as the female condoms. So there's lots of different products that we can purchase on the market to give us greater safety. Certainly I encourage all of them. Points for consideration. It's super important to remember that, most of our condoms, we recommend latex condoms. That includes the female condom, the male condom, and the dental dam. If there are latex allergies, certainly, and we understand that. And so if allergic, we recommend consideration of a polyurethane condom that does give some protection against your STIs. More so than your natural or lamb-based product. So some protection, but you do need to still consider that there can be some reduction in that protection. Condoms break. If it happens, they're not infallible. Even, if you put them on correctly, we certainly, it's a different sort of topic of conversation, but not a different topic of conversation because we are talking about safer intercourse. But when putting on the condom correctly, it rarely does break. If it does, again, it's not infallible. We do recommend getting tested. You and your partners getting tested within 10 days of that event. And certainly also keep in mind with the female condom, less likely to have a tear, but not impossible. And certainly the same goes for if there is any break in it, recommend testing within the 10 days of that exposure. Female condoms, we typically recommend inserting them much like a tampon. So most of us women are familiar with that. I did want to also make sure I did discuss PrEP. You hear about that on TV. A lot of people, especially in my clinic, patients will ask me, what the heck is this? And it's certainly specific to HIV and pre-exposure protection. Super important. And I've had several patients ask me, oh, so I can do this and protect myself from everything. No, not everything. It's only for HIV prophylaxis, excuse me. It is not to protect against other STIs. So that's super important that everybody remembers that. It's important to get regular testing. It's okay to get regular testing. It's okay for you and your partner to get regular testing. It's taking care of each other. And that's what I try to remind everyone when I talk about these issues. We're taking care of each other. We're all taking care of each other. And that's what's important. So it is totally okay and super proactive and very responsible to get regular testing. And then certainly also consider pre-testing. I have a lot of patients that are on the younger side as well as on the older side. I see the whole gamut. And patients will come in and ask me, can I get myself and my partner, can we get checked to make sure that we're good before we start, engaging in intercourse? We're talking right now, but we're thinking about it. What can we do, to make sure that we're okay? And sure, pre-test, get regular testing, but still try to be as safe as you possibly can, and have fun. That is all I have for right now. So I'm going to open it up for questions. I know, Jeff, I know you said that there were some questions that
Yep,
might
and I will
have.
feed you those, so don't worry.
Okay.
But wow, great information. And hopefully listeners, you feel, first off, we just want to inform you and help you understand, and then hopefully reduce some of the fear, but at the same time, help you to make good choices. Because it's scary, right? And and I love too how you talked about some fun ways to use barriers, apply barriers, and integrate it into your love play with your partner, make it fun. And we have such great things between the dental dams, the female and the male condoms. There's lots of good things, and they have all kinds of flavored things and just things to make it fun and enjoyable for you. So I think that I really enjoyed that aspect of it that you talked about. That really important. In addition, I like that you brought up, I do have quite a few patients on PrEP, and I think it's just really important. There are other STIs out there that you certainly can get. You are not protected against them without some of these barriers. And so just keep that in your mind. It's very, very important. But I do have people on PrEP and they find it pretty easy to work with taking that medication, especially when the concern is HIV, which is the only thing it really protects against, and find it to be very, very helpful and important for their sexual practices. So I think PrEP is a really important thing for people. That prophylactic medications, they are antivirals that you take prophylactically against the HIV virus. So really good information. Also, when those condoms break, I think, or even you start worrying, you're like, oh my God, I thought I knew everything and now I'm worried that I got something. You go in for your testing, you find out what's going on within that 10-day period. It's going to be okay. It's really hard not to freak out, but go get your testing and make sure that everything is okay. But
And two, also, if, Jeff, I did want to make sure I let our listeners know, our viewers know too, that going in and getting testing nowadays doesn't necessarily mean having to go in and get that horrible pelvic exam that most every woman, I think, when they're on the table with me, they're always like, oh gosh, why do I have to do this? We can actually check for a lot of these infections: chlamydia, gonorrhea, trichomonas. I didn't even mention, mycoplasma, ureaplasma. We can evaluate those via urine testing. So it doesn't necessarily mean that we have to go through this just horrifying exam. It may just mean peeing in a cup.
I'm so glad you brought that up, because the men, they see those swabs coming out and they're like, oh, mother of God, you're not going to put that in my urine. But we've come so far with the testing that most of it can be done through blood and urine and things like that, which is amazing.
Yes.
So don't be afraid. In fact, I use a swab to check people to say, can you feel the difference between the cotton and the pointy end? And I can't tell you how many men are like, what are you going to do with that swab? Where's that swab going? It's like, nowhere. I'm just going to tap the skin with it so we can make sure you can differentiate soft versus the pointy end of that cotton swab. I promise you, I'm not going to put it in your urethra. That's a really big myth, I think, too, because it didn't used to be. It was the reality of STI testing, but it is no longer the reality of it. So
Exactly.
really, really, really good point. Well, our first question I thought was an excellent one. The listener said, I'm starting to date again after a long relationship. How do I bring up STI testing without sounding like I don't trust the other person, or like I'm asking too soon or whatever, I thought that was a great question.
Yeah, that is a good question. And it is always a tough conversation. I think that all of us, I would definitely say all of us feel fear or worry, certainly when bringing up that topic. What I strive to try to impart to people, though, is when you are in those early days, weeks, months of a relationship, it's not an issue of, I don't trust you, I want to find out where you've been, what you've done. It's, I also want to protect you. So I want us to be checked because I want to protect you, as well as I, would imagine one's partner would want to protect me or that person. So that's kind of the way I sort of try to open up the conversation. We're getting more serious. This is something that maybe y'all might be talking about and are considering. You're entering into a more intimate type of the relationship. And it again it's not an opportunity to say, I want to make sure you're clean before you touch me. It's I also care about you, and I want to make sure I don't have anything that I can give you, and that I know, you want to protect me. we protect each other.
Mhm.
That's kind of how I approach it. I hope that that makes it easier for people to have that conversation because it's coming from a point of caring. It's coming from a point of, I want to be with you and I want to make sure that we're okay. That's how I try to counsel people.
I love it. So so again, coming from a place of caring rather than accusing. So, and making that clear. This has nothing to do with accusing. This is about caring for our sexual health, both of us.
Right.
And I also think it can be important to kind of normalizing it for people. Like, for example, let's say this is an older couple. STIs are most common these days in older people. So
Yeah.
it's so important for us to just both make sure everything's okay. I think that's a great approach to that
Yeah.
question. So I think that it should be very helpful for listeners. The next question. I had an STI years ago and still feel ashamed sometimes. How do I let go of that fear and be honest with future partners without feeling judged?
That's a tough one because we as a society do introduce a lot of shame and just not very fair, not very kind, for sure.
Mhm.
The truth of the fact of the matter is, as I mentioned earlier, there is as much as 65 million, if not more, diagnosed cases of curable STIs per year. So at the end of the day, there's a lot of us who've probably had something.
Mhm.
And so it is incredibly common. It is probably also almost impossible for a person to come into contact with a person who also has not been exposed or been treated for something. And so I feel like what we need to really think about is certainly we need to be a little kinder to each other, but we also need to think about it. We're all probably in the same boat, and it's okay because we're probably all in the same boat. And so I hope that you don't feel shame. I hope that you feel good about yourself in the fact that one, you're getting educated at this moment right now. You want to learn more to protect yourself and to protect others. And keep in mind again that we're all in this together. We got to take care of each other. If I can't, you know, impart enough of all this kind of numbers and stats and things like that and information in my talk, I definitely hope that I can impart to people that it's okay, and we just need to talk, and we need to give each other a little bit of grace. We all need to give each other a little bit of grace.
Mm. Yes. And two, listener, what I would like to remind you is there you are not your STI. It does not define you. It is not who you are. You didn't set out to get an STI. You didn't. There's no shame or blame. And like Dr. Hull was saying, they're very common, and it's not anyone's fault. Nobody was like, I intentionally wanted to get this STI. So
Right.
so there is no shame or blame. So I hope you really truly understand that, and that you are not defined by that. That is not who you are. You are so much more miraculous and amazing than all those diabetes, high blood pressure, sexual dysfunction. None of these things are your fault or our fault. They're things that happen to us that we have to deal with. So I think if we as a society could remove a lot of that shame and blame and just know diseases are part of life. They're everywhere and they're no one's fault. They're no one's fault. Now, I do think that if we can also learn and take precautions, wow, that's really empowering too. But
Exactly.
if you already have an STI, it's not your fault and it doesn't define you. So I hope that is helpful. Our last question that I had is, what are some of the most effective and most underused forms of STI prevention that you wish more people knew about? What do you think?
Obviously, whenever we think about product use, we always think about the condom.
Mhm.
I don't have the numbers, so I can't say, but I do think there's probably an underutilization of the female condom.
Mhm.
And I think a lot of times too, we don't think about dental dams as being protective and keeping that, but it is, it is a good product to use with oral intercourse.
Mhm.
And so super important. I do believe that, yes, we think about first and foremost the male condom always, but the other products are underutilized. There's always opportunity for use of other types of, or excuse me, having other types of intimacy
Mhm.
that perhaps can give pleasure without potentially increasing risk. But the fact is that we want to be able to have the full experience. And so I would certainly encourage people to be more mindful of other product like a female condom or a dental dam for sure.
That was
I don't know what other products you might know about, Jeff, too.
No, I was
That
thinking the exact same thing, and then I love that you bring up we had an amazing podcast a couple weeks ago where we had a panel, and we talked about non-penetrative sex and things where those bodily fluids would not necessarily be absorbed into someone's body because there's not penetration, even oral penetration or whatever. So there's all kinds of good suggestions on fun things you could do where you don't have to worry about exchange of fluids as well. So I think that's a
right.
great suggestion as well. I would agree with everything you're saying. I think too, dental dams, I think people just don't even know they're out there and that they're effective,
Yeah.
nor the female condom. I think many people don't either. People just think the classic condom, and there's a
Yeah.
lot more out there now and lots of fun things to discover. So look at that carefully, listeners, and figure out what works for you. Um, awesome. We have covered some really great information. What I'm going to do is I'm going to go to our closing exercise, and then I'm going to come back to you and see if you have any final thought for our listeners. We're going to do our closing exercise and then talk about what's coming up next week, and then come right back to you. So I'll be back your way, Amy, in just a minute. Okay, let me get this set up. So speaking of things, I am working with now um, a teleprompter. So I'm getting used to that. So just so you know, full disclosure, that we're doing, but I'd like to do the closing exercise using it because it's really helpful. All right, so here we go. Before we close today's episode, I want to invite you to take just a moment to breathe with me. Sexual health can bring up feelings, fear, shame, relief, curiosity. I love curiosity. Or even empowerment. Whatever your feeling is, those feelings are welcome. Now, take a slow, gentle breath in your nose and let it go. Make sure you're seated comfortably, and if you can, place your hand over your heart, or you can place your hands over your abdomen, whatever's most comfortable, wherever it feels comfortable. Continue that breathing pattern in your nose for about 4 or 5 counts, and out your mouth for 4 or 5 counts. As you breathe, imagine a quiet, steady light growing beneath your hand. This is your inner wisdom, your ability to care for yourself. We often neglect that self-care. We take care of others, but we don't take care of ourselves. You can't take care of others without taking care of yourself. That care of yourself, that ability to ask questions, to seek clarity, to choose safety, and to show up with courage and compassion in your intimate life. Breathe in and think of the term, I deserve knowledge. I deserve knowledge as you breathe in. Breathe out. I deserve safety. As you exhale, I deserve safety. Now, slowly, gently continue that breathing pattern in your nose and out your mouth. Breathe in. I deserve pleasure. Breathe out. I deserve healthy connection. Let one more deep breath flow in and a deep exhale out. When you're ready, gently return to the room around you. Open your eyes if you had them closed. Return to your surroundings and know that your sexual well-being is an essential part of your whole person health. And you are worthy of care, honesty, and joy. You are so much more than any disease process that you're struggling with. We all have something we're struggling with. You are so much more than that. You are miraculous and beautiful, and you are more than enough. Take some deep breaths in and exhale. Okay. All right, Vic, what's up next week on Dr. Jeff Talks About Sex and Intimacy?
In this episode, Dr. Jeff welcomes Dr. David Luyando to highlight the overlooked role of the urogenital diaphragm in sexual health and intimacy. Drawing from chiropractic and integrative practice, Dr. Luyando explains how breathwork and pelvic awareness can improve both physical well-being and emotional connection. He introduces the topic and then guides listeners through simple breathwork exercises. Join us on December 2nd at 7 p.m. Central Time to learn more.
Yes, and I am looking forward to that next episode. My good friend, Dr. David Luyando, will be joining us. He's certainly done a lot of amazing work with me as my chiropractic expert, my chiropractor, my acupuncture guru, my Qigong guru, and my breathwork guru. So I can't wait to share his insights with you. But this week, wow, Amy, packed full of great information. Really appreciate all of your insights and all your information to inform our listeners and empower them, so to reduce some of the fear. Any last thoughts for listeners today as we close out?
Well, I was thinking as we were doing our breathing exercise, I was thinking there are so many things in life, just as you alluded to, that can give us sadness, anger, fear, you name it. There is absolutely nothing wrong with seeking out pleasure and seeking out community and communication and interaction with somebody close to us. And so I hope that we can help our listeners, our viewers, understand that, just as you said, it's okay. We're all in this same boat together. We're all in this same boat we call life. And most of us, we all think we're all very, very different. But at the end of the day, I have pretty strong idea that we're probably all pretty much alike. And so most of us, we're all experiencing this our lives probably pretty similarly in many ways, and there's lots of opportunity to continue to communicate and reach out and engage and want to have those close relationships with people, and that certainly does translate into having healthy intimacy and open and honest intimacy with our significant others, and so if I hope that that's what people learn from listening today is is it's super important to always be safe as possible, but to also seek out the opportunity to have pleasure and communicate and have that closeness.
Mm. Yeah, research shows that intimacy is something that most of us, it's something we crave more than anything else, but it's something we're the most fearful of because it makes us
Right.
really vulnerable. So you're not
Right.
alone, and it's like, just like you said, we're all in this together and we all have our stuff. You might look around and think, oh, Dr. Hall has it all together. Dr. Alba has it all together. Dr. Whoever or whoever, because they have this or they have that life. We all have our stuff. And if we laid it in the middle of the room, you'd grab your own stuff and run for the hills because you wouldn't want anybody else's, because we all have things that we deal with, just like you do, listeners. So I hope you find some helpful information in this. And I hope in this time of Thanksgiving, my greatest hope and prayer for you, listener, is that, and viewers, is that you have something you're truly grateful for in your life, and someone, whether that be a sexual intimate relationship or just someone who is your rock and there for you, because we're all hardwired for that. And it's so important to be deeply connected with others. But gosh, Amy, we have been friends for a couple decades now, and it's just always such a pleasure to see you. You are a remarkable human being. You have an
Thank you.
amazing family. Thank you so much for sharing your expertise and your time with us this evening. Definitely.
Thank you. Thank you so much, Jeff. And I just can't say enough wonderful things about you. You are so fantastic, and I just love the work that you're doing. So thank you for
Well,
the
thank you.
opportunity.
And thank you, Vic. I don't know what we do without you because you make this all seem seamless. You are like the wizard behind all the things we do. And most of all, thank you, listeners. Have a wonderful holiday season. And thank you for being here.
As Dr. Jeff talks about sex.